Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in today. On this show, we'll talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at #PaymentMatters and follow me at Jeff B. Lin on Twitter. Today's topic is security and compliance in healthcare payments. We know that security concerns aren't going away in healthcare and have been around for quite some time. The healthcare industry continues to be the target for cyber attacks, and industry stakeholders are concerned, especially when it comes to healthcare payments. We've seen some metrics that 96% of providers and 94% of providers report that security is a critical importance when collecting healthcare payments. So what do payers and providers really need to know when it comes to protecting payment data, especially as they work to deliver really more and new convenient ways to collect payments from consumers? Excited to say that joining us today in conversations are Noah Dermer, the security officer at Instamed, and Jon Sternstein, principal at Stern Security. Thank you both for taking the time to chat with me today. Noah and Jon, starting off with Noah first, can you introduce yourself?
Absolutely, Jeff. A pleasure to be here. And my name is Noah Dermer. I'm Instamed's security officer. I'm formerly Epic's chief security officer, chief privacy officer, having worked at Epic for just under a decade and collectively now over 2 decades of IT experience. So pleasure to be on the show today.
Great. Nice to have you on board. And Jon, you mind just doing a brief introduction about your experience and your role?
Sure. I'm Jon Sternstein, founder and principal at Stern Security, cybersecurity company focused on protecting healthcare organizations. Prior to starting the company, I was a healthcare security officer at a large healthcare organization, and prior to that was in several security engineering roles. I also teach ethical hacking classes and recently released healthcarebreaches.com, interactive dashboard providing insight into healthcare breaches.
So we have 2 great guests today that can talk about having a wealth of experience in the entire continuum of security and compliance. And I'll say the first question I'm gonna bring up to ask Noah this, which is security and compliance. And sometimes these terms are interchangeable. And what's your definition of security and compliance, and how should people view the differences between each?
I think it's a great question, Jeff, because we often see people get confused, or when they're going through and working with different vendors or solution providers, they start confusing the two. And so I think when you look at security, you're really looking at the tools, technologies, policies, and procedures that organizations have put in place to protect data. And so you think about things as simple as virus scanners with up-to-date definitions of what a virus or malware might be, patch management, rolling out of patches, whether it be Microsoft, Apple, et cetera, in a timely manner. Looking at more expensive technologies, obviously things like firewalls, intrusion detection, intrusion prevention systems. And you look at those sort of layering on top of each other to provide the security for either a healthcare organization or businesses more generally. And in contrast, compliance is really the ability to align your security policies and procedures to standards. And so you think about standards like HITRUST, HIPAA, ENAC, PCI, or more generally even like a SOC 1 or SOC 2 report. And what one thing that you really want to look at when you're talking with a vendor or looking at a program is the vendor's ability to align and build in their security program. If the vendor has started out from day one building a strong security program, it will naturally flow into their compliance initiatives. In contrast, if compliance is driving your program, it's going to be this sort of puzzle that they're always trying to fit together, where they're trying to align their technologies and security to align to whatever the latest compliance program is that they either recognize that they need to achieve, or that perhaps are getting feedback from the market that they need to do. And so when you build with a foundation from the ground up of a good security program, it flows naturally. In contrast, if you reverse the two, where compliance is driving security, it gets much more challenging. And ultimately what you want is a vendor who has layers of security to protect the data that you're trusting them with with a compliance program to make sure that you're comfortable, that you don't have to dig, deep into the reports to understand what they're doing, that you understand that, hey, yes, they get healthcare, they get payments, or whatever other industry that they're in. You want to make sure that what they're doing aligns to your organizational needs.
Got it. Thank you, Noah. Let me ask this to Jon here, which is, from this perspective of security and compliance, is one more important than the other?
You really need both. Noah's right on point with what he mentioned between the difference between the two. I look at compliance as really the bare minimum criteria that you need to protect yourself. But like Noah mentioned, you really need to have that strong security program in place. However, I know that many organizations probably would not even look into security, no matter how important it is, if compliance regulations weren't telling them they had to do that. So I think you really need both.
So continuing with Jon here, as we talk about the nature of security and compliance and how critical they are with each other, what kind of threats do you see out there? Why should a healthcare organization be focused on this?
Hopefully they're focused on it because they really truly do care about protecting the information that their patients are trusting them with. So hopefully that's the number one importance. But there are many threats that are targeting healthcare organizations, from hacking, as we all know. Medical records are incredibly valuable, so intruders have discovered this and they're fully taking advantage of that. There's also malware, which is a huge threat. It's related to the hacking incidents, but we have seen on the news, we've all seen ransomware attacks that have completely immobilized healthcare organizations, many of them going back to paper records for days. And there are many other threats too, whether it's phishing or staff members accessing records they shouldn't, or physical theft. And there's quite a bit of human error as well, and organizations simply losing track of patient information by mistake, or releasing them when they did not mean to. So plenty of issues there with security.
Got it. Let me ask Noah here, as we look at kind of as Jon alluded to, the variety of attacks, the phishing, the malware, the human error. What's the financial or repercussions of these attacks on these organizations? How would you characterize that?
Yeah, it's always difficult to give a specific number to quantify it perfectly, but I think you can first off think about, well, what is the financial impact of this occurring? And obviously in Jon's case, right, the reverting of a healthcare organization from electronic to paper record, that's a distinct thing, right? So you're talking about the time of, let's say, your operating rooms not being fully utilized, perhaps even diverting of patients, the changing of patient care. And then you can think about, well, what does it take to sort of analyze the problem and remediate it? And with remediation comes, requests for perhaps from the people who have trusted you with their cardholder information or checks information for various credit monitoring services or otherwise. And then things like, well, how are you certain that once this intruder is in your network, how do you make sure that they're out of it? And then, of course, there's a reputational risk. And I think that's probably the hardest one to quantify and also the most significant, which is, well, what does it mean for your reputation in the community or, throughout the nation? And what is it going to do to your long term? And so I think it's important to think about, all those aspects of it. And perhaps, Jon, I know you've done some work on this. Can you speak a little bit about, sort of the penetration testing that you've done to help organizations understand where they're vulnerable and how to remediate it?
Sure. So part of our services, we do testing to basically find vulnerabilities before intruders do. And it's very, very common where completely from the internet, we're able to look at vulnerabilities in the healthcare organization and completely gain access to their internal network and fully access all patient records in there. So we help the organizations at that point fix those issues so nobody else can exploit those, and help them remediate everything. So moving forward, they don't run into issues like that again. But those are fairly common. I'm sure we've all heard them on the news. And some of the recent numbers that were released for healthcare breach numbers were that it's about $408 per record loss is how much it costs an organization when they get breached. So pretty high numbers. That's the most out of any other industry.
Yeah, that's an interesting point here. Is there are clear financial impacts, and Noah alluded to reputational impacts. Jon, interested in your perspective here. I've been doing this for quite some time. Without naming names, can you allude to any examples as you explore these healthcare organizations out there in terms of the gaps that you've seen? And any interesting anecdotes or stories that you can share from your experience?
Sure. We definitely come across similar issues across the board. One of the issues that we commonly come across is the weak passwords. So remember, there's a few different engagements we've been on where an organization will say, hey, this is our patient portal. It's probably the one that the main target from the internet that we need to worry about, and this is the one that you should examine. However, we find other systems connected to the internet that have very weak passwords, and we notice that once we gain access to those weak systems, we can fully access the patient systems, whereas the patient system by itself might be pretty locked down. Notice that it's really, you have to protect your entire environment. You're only as strong as your weakest link. So we often see systems that are test systems that are connected to the internet, or systems with default passwords, or organizations don't have two-factor authentication enabled, so individuals can log into their EHR or their email accounts with just a username and password instead of tying their phone to it. So most of those, if they don't have some of those basic security features in place, like changing passwords and using two-factor authentication, it's usually pretty simple for somebody to get into the environment from the internet.
Wow, yeah, that's pretty scary stuff, considering how easy it is for someone to get into health organizations network here. Let me ask Noah this, as Jon alluded to the gaps, and you alluded to earlier the financial repercussions. What should healthcare organizations do to protect themselves? Sounds like there's things we can do, but what would you tell a healthcare organization what are the best practices, things that they should follow to kind of protect their data?
Yeah, absolutely. I think one of the things that they should start off with is a risk assessment, which according to HIPAA they should already be doing, and I'm sure most are doing it, and take a look at the entire organizational picture to understand what risks you've identified. And jumping in with an anecdote of my own here, if you go back to the mid-90s, there was a hacker named Kevin Mitnick. And what he realized was, you don't need all this technology to hack into organizations. You can basically just use a little combination of social engineering and human interest. And if you drop floppy disks with the title sort of on the top right that says HR salary files in the parking lot of an organization that you want to get into, human nature gets the best of most people, and next thing you know is they've either inserted that floppy disk into their computer at work or at home. And I think you can quickly translate that to the modern equivalent of, let's say, a USB thumb drive or maybe a DVD, CD-ROM, something like that. And so you want to think about what are the aspects of your organization that you can help improve to further protect both the healthcare data and the healthcare payment security. And so doing risk assessment is a great first step to understand the risks in your organization, either internally or looking at a third party to help you out if it's something that's new to you. And then definitely building in the factor of educating your employees. Your employees are the ones who will be dealing with social engineering attacks, potential human error, of course, and then receiving perhaps phishing emails and the like. And you can obviously build in lots of technologies and tools, whether it be spam filters, disabling, let's say, removable media. But ultimately, you want to make sure your employees understand what it is that they're trying to do, which is ultimately to provide a great healthcare experience to that consumer, to that patient, but also to protect the underlying data. And so the idea that they should feel free to report potential incidents, potential things that they're seeing, even if they're not 100% sure, have them report them to the security officer, security team at the organization without feeling like, oh, well, I'm going to be judged or punished for this. No, you want an open culture where people report potential issues so you can evaluate them, hopefully before they become actual issues. So I think that's one of the biggest do's. And then the other big do, of course, is, if there's data that you don't need to be processing it directly. And I think, healthcare payments is a great example of that, which is, hey, you should be using, let's say, encrypted credit card terminals. Keep that credit card data off your network. With the modern terminals today, there's no need for unencrypted cardholder data information to be flowing through your computers, whether it be front office, back office, or that patient portal that John referenced earlier. You should be outsourcing that to someone who actually is focused exclusively on healthcare payments. Have them develop those tools and technologies that makes it easier for your patients to make their payments while keeping that data off your network.
Well, thanks, Noah. And for those listeners just tuning in, you're listening to Payment Matters. I'm joined by two security experts, Noah Dermer and Jon Sternstein. And we're talking about security and compliance in healthcare payments. So Jon, Noah talked about all the things that health organizations should do, and there's a long list, and those are important things. And I heard Noah talk about third-party assessments and so on. Clearly, there's a lot of health organizations, large and small, and in a large organization, they probably have budget and people allocated to this. What would you recommend for the small organizations that don't have large IT budgets, that don't have potentially dedicated security staff? What should they be thinking about to protect themselves from these attacks that are occurring today?
That is a great question, and a lot of organizations are struggling with that. But there are definitely some things that they can do. I mean, small organization, they have to protect their information just as much as a larger organization does. But there are some resources that are available to smaller organizations. One thing that they could do is they can go to the Health and Human Services website, and there's a tool on there that they can use to do a self-assessment for HIPAA compliance. It's really a risk assessment questionnaire that it walks you through, and once you find out some areas that you're weak in, you can focus on those areas to get additional help on. So instead of perhaps doing an entire assessment, you're hiring somebody to do that right off the bat. You could find out what areas you're generally weak in, and then you can hire somebody to tackle those areas. Or you can use the questionnaire just to understand how far behind you are and start saving some budget for that. But also you can work with organizations on it. It's tough because security professionals can be very expensive, especially nowadays with a large shortage. But organizations will tend to work with smaller organizations, so you don't have to do your entire assessment all in 1 week. You can spread it over time, and that's really what's important to protecting yourself. Security is not a point in time, so smaller organizations could benefit from really stretching out the security assessment process over several months.
Got it. Sounds like security compliance is all about, it's a marathon, not a sprint, right? And there needs to be a long-term strategy and roadmap for that. Let me ask. Yeah, let me ask this and to Noah here, which is, there's always a balance here, and when we talk about security compliance, balanced with user experience, right? and either making the consumer's job easier to do something, or make it easier for the people that work in these health organizations to make their life easier. There's always that balance. And how should an organization view that balance between being ultra conservative and security and locking it down versus actually having a really easy experience. How would you approach, and how should organizations kind of view that?
Yeah, well, I think they can actually be aligned together. And I go back to something that occurred a few years ago, which was there was an organization that was trying to figure out if they were going to roll out a mobile app. And the mobile app would allow patients to take pictures of their condition, right, and send it back to the doctor for analysis. And the security team was doing this, in-depth analysis of the app, trying to understand what it was. And someone finally asked, well, what's the current workflow look like? And what they realized was the current workflow was that the patient would either text message or email it to the doctor, perhaps on the doctor's Gmail account or on their corporate, email account. And so I think the first thing to step back when you're doing this is to ask, well, what is the status quo? Because, yes, there may have been a vulnerability or issue with the app, possibly, but the actual status quo was pretty bad. And so I think what you want to look at is, first off, well, what are you doing today? And then secondly, how can we align the two? Because when you think about, in particular in the payments industry, there's been a lot of advances that actually improve both the security and compliance and also the patient experience. And so you think about things off the bat like Apple Pay, right? The ability to show up and make a payment with my phone. If I can do it at Whole Foods and I can do it otherwhere, why can't I show up to my doctor's office and do the same thing? And then similarly, a digital wallet. We often view this as a technology that really helps consumers make their payments in an efficient manner, much like they would on Amazon. But by creating tokens and not storing out the actual credit card numbers, we get both a security win and improve the overall consumer experience. And so I think you can actually unify those. And when you find the right partners in the industry to align those, you should definitely work with them because if they're not keeping up with the latest trends, your consumers will be disappointed, but also your security may be falling behind as well.
Got it. It's sometimes the best solutions have both in mind, and that makes it more secure. Jon, I guess question for you as more and more data breaches are occurring out there, and I'm hearing ransomware across the board. But what do you think organizations should learn from these breaches? Like, what can we do to prevent them? Are there key tactics? What are things that we should be thinking about here tied to these data breaches?
So reviewing past breaches is incredibly important. That's why we created healthcarebreaches.com, so you can see the different trends in healthcare data breaches. So as we look through past breaches from 2009 to today, we could see that many organizations have been breached through such actions such as phishing, and we can see from there that maybe these organizations did not have education, security awareness training for their staff. They also did not have two-factor authentication. So we can learn from those breaches and say, well, quite a few organizations are getting hacked through their email accounts. Maybe it's time to educate our staff about these types of threats and also tell them to implement things such as two-factor authentication. We also see quite a few breaches where organizations have a wealth of information that they may not need. And this is going back to Noah's point. If you don't need to store the data, or you do not need to store the data yourself, then why hold it at all? If you don't have that information, then you don't need to protect it. If you can defer the risk to another company that's focused on that, then definitely do that. For ransomware, we can see a huge spike in ransomware breaches for organizations, and that can teach us the importance of having really good backups in place, of there's having good endpoint protection in place, and learning how to quickly recover if parts of your network are down. There's so many different ways to protect your information from malware. So there really isn't anything new that we just discovered this year how to protect organizations from that. These are common things that if you have a good security program in place, you should be able to respond to that. But I mean, if looking at past breaches, everything is not is not negative or doom and gloom. We can see that we're actually getting better in some areas. So if you look at the trends, you can see that breaches due to theft of laptops and desktops and USB drives is down. And I don't believe that is because less people are stealing laptops. I think it's directly contributed to everyone getting better at using encryption, full disk encryption, encrypting their USB drives, or not even putting that information on USB drives. So we can see that we're getting better at some things. And going back to small organizations, how they can use this information, I could understand how that can be really overwhelming, but nobody does this on their own. So I'd highly encourage both organizations, both large and small, to work with other organizations, network with similar organizations, join healthcare security groups such as Chica and HIMSS, listen to this podcast, join local security groups, just because it is a team effort across the industry.
Great. Well, Noah and Jon, this is great for our listeners to hear from two experts that are really tackling these critical issues tied to payments. And so once again, I do want to thank our special guests today, Noah Dermer and Jon Sternstein. So to Jon and Noah, if they wanted to find you, our listeners wanted to find you and interact and maybe potentially understand more about compliance and security, can you talk about any social media or how would they connect with you? And I'll start with Jon.
Sure. People can follow me on Twitter at Jon Sternstein, or follow our company at Stern_security on Twitter, or visit our website at www.sternsecurity.com or healthcarebreaches.com.
Hey, you can follow me on my Twitter handle at Noah Dermer. And then you can also read our pieces on the Security Corner, available on instamed.com.
Well, once again, thank you to our guests today and to all of our listeners. Remember that you can listen in to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. If you have a comment, questions about the episode or the show, follow #PaymentMatters or connect with me on Twitter at Jeff Lin. You can learn more about my show at healthcarenowradio.com or at www.instamed.com. Until next time, I'm Jeff Lin.